Welcome everybody in the episode number 3 of the neuroscience tutorial question and answer. Let's start with question number 1. A 32-year-old woman visits her physician with multiple concerns. During the examination, she reveals that she has double vision, diplopia, has noticed weakness of her right upper and lower extremities, and has diminution of pain sense on her left hand and forearm. She also reveals that her symptoms have sometimes been worse and then seem to get better for a while. MRI reveals area of diminution that correlate with her symptoms. Which of the following explains the woman's deficits? A. Damage of the membrane of axon. Damage to intra-axonal microtubules. C. Failure of the development of generator potentials. D. Failure of generation of end-plate potentials. A. Failure of saltatory conduction along the axon. Answer and explanations. The correct answer is A. Failure of saltatory conduction and along the axon. Failure of saltatory conduction along the axon. Multiple sclerosis, which is a demyelinating disease. This disease is characterized by the fact that deficit may wax and wane, i.e. exaggeration and remission, or exacerbation and remission. Multiple system may be involved. It is another characteristic of multiple sclerosis, divided from its name. And MRI is preferred diagnostic tools. Saltatory conduction, from Latin salte, to hub or leap, is the propagation of action potential along the myelinated axon from one node of Ramphia to the next node, increasing the conduction velocity of action potentials. The loss of the myelin results in a failure of saltatory conduction due to the fact that the paranodal potassium channel opposes the sodium current at the node, and the action potentials degrades rather than reaching threshold. There is no damage to axon or intracellular microtubules. The three main characteristics of MS are: 1. The formation of lesion in the central nervous system, also called plaques. 2. Inflammation. And 3. The destruction of the myelin sheaths of the neurons. Again, the three main characteristics of MS are the formation of lesions in the central nervous system, also called plaques, inflammations, and destruction of the myelin sheaths of the neurons. Cholesterol crystals are believed to both impair myelin repair and aggravate inflammation. This is cholesterol crystals. Additionally, MS is believed to be an immune-mediated disorder that develops from an interaction of individuals' genetics and as yet unidentified environmental causes. These lesions most commonly affect the white matter in the optic nerve, brainstem, basal ganglia, and spinal cord, or white matter tracts close to the lateral ventricles. The function of white matter cells is to carry signals between gray matter areas where the processing is done and the rest of the body. The peripheral nervous system is rarely involved in MS. MS involves the loss of oligodendrocytes. The cells, i.e. oligodendrocytes, are the cells responsible for creating and maintaining the myelin sheath, which is a function of Schwann cells in the peripheral nervous system. Another process involved in the creation of lesion is an abnormal increase in the number of the astrocytes due to the destruction of nearby neurons. Generator potential is stationary depolarization of a receptor that occurs into response to a stimulus and is graded according to its intensity, and that results in an action potential when appropriate threshold is reached. Called also receptor potential, i.e. generator potential, called also receptor potential, i.e. generator potential not subjected to all or none law. The interplate potential EPPS are the depolarization of skeletal muscle fiber caused by an opening of the acetylcholine channels, and this acetylcholine binds to postsynaptic membrane in the neuromuscular junction and leads to the sudden inward movement of sodium ions. Neither of these potentials is directly affected in multiple sclerosis. Question number 2. Bipolar cells are characteristically seen in which of the following location? A. Aortic-renal ganglion. B. Amygdaloid nucleus. C. Cerebellar cortex. D. Posterior root ganglion. E. Vestibular ganglion. Answer and explanations. The correct answer is E. Vestibular ganglion. Bipolar cell is type of neuron which has two extensions, characteristically found in association with cranial nerves that conduct special sense, for example, retina or olfactory epithelium, and the peripheral ganglion of the vestibular and cochlear nerve. And this is very characterized place for it. Peripheral ganglion, vestibular, and cochlear nerve. The functional component associated with these bipolar cells is special somatic afferent or special visceral afferent, i.e. it's afferent, not efferent. The aortic-renal ganglion, amygdaloid nucleus, and cerebral aortic-renal ganglion, amygdaloid nucleus, and cerebral cortex have multipolar cells that may assume variety of size and shape, but they all fall into multipolar category as broadly defined. Multipolar neuron is a type of neuron that possesses signal, axon, and many dendrites, allowing for the integration of a great deal of information from other neurons. These processes are projections from the nerve cell body. The posterior root ganglion characteristically contains unipolar or pseudounipolar cell body. Pseudounipolar neuron is a kind of the sensory neuron in the peripheral nervous system. This neuron contains an axon that has split into two branches. One branch runs to the periphery and the other to spinal cord. Pseudounipolar neurons are also found in the sensory ganglion of the cranial nerve. Number 5, which is trigeminal nerve. Number 7, which is a facial nerve. Number 9, which is glossopharyngeal, and number 10 is a vagal nerve. Also mixed cranial nerve. The vestibulocochlear nerve has a bipolar neuron type on both the spiral cochlear ganglion as well as scurvous vestibular ganglion. A vestibulocochlear nerve has a bipolar neuron type in both spiral ganglion cochlear as well as scurvous vestibular ganglion. And this image illustrates the difference between pseudounipolar and bipolar. This is pseudounipolar. Arise one axon, then split it to two branches. But in bipolar cells, there is axon from each pole of the neuron. Question number 3. A 55-year-old man visits his family physician with the complaint of a slight tremor in his left hand. The examination reveals that this tremor basically disappeared when the man performed a voluntary movement, but this man also has a slightly shuffling gait and bradykinesia. The results of the evaluation indicate that the man has early Parkinson's disease. The physician decides to start the man on a regimen of levodopa carbidopa. Generic name is Cinemet. Which of the following, if also a component of this man's overall clinical condition, would be an absolute contraindication for using this particular medication in this man? A. Anaplastic astrocytoma. B. Glioblastoma multiform. C. Malignant ependymoma. D. Malignant melanoma. E. Malignant meningioma. Answer and explanations. The correct answer is D, i.e. malignant melanoma, because dopamine, which is an essential part of this regimen, is a precursor in the synthesis of melanin. Melanin is found in the cells of substantia nigra pars compacta. Substantia nigra pars compacta are part of nigrostriatal dopaminergic pathway. The administration of precursor of melanin in the patient of malignant melanoma will most likely stimulate the growth of this tumor. The substantia nigra, SN, is a basal ganglia structure located in the midbrain that plays an important role in reward and movement. Although substantia nigra appear as a continuous band in the brain sections, anatomical studies have found that it actually consisted of two parts with very different connection and functions. The pars compacta SNPC, i.e. substantia nigra pars compacta, and pars reticulata, i.e. substantia nigra pars reticulata. The pars compacta serves mainly as an output to the basal ganglia circuit, supplying the striatum with dopamine. Parkinson's disease is characterized by the loss of the dopaminergic neuron in this part. The pars reticulata also serves mainly as an input, conveying signals from the basal ganglion to the numerous other brain structures. So don't forget, the pars compacta serves mainly as an output, while the pars reticulata serves mainly as an input. The administration of levodopa would not have any significant unwanted effect of any of the other choices: anaplastic astrocytoma, glioblastoma multiform, malignant ependymoma, and malignant meningioma were concurrently present in this man unless they contain pigmented cell. A pigmented cell, the tumor, which is called primary melanocytic tumors of the central nervous system, are uncommon lesion. This lesion arises from the melanocytes located within leptomeninges. Leptomeninges is pia and arachnoid matter and include diffuse melanocytosis and meningeal melanomatosis seen in neurocutaneous melanosis, melanocytoma, and malignant melanoma. Also, ependymomas are usually a lesion of younger persons. Ependymoma is a tumor that arises from ependema, the cell membrane of glial cells lining the ventricles of the brain and central canal of spinal cord. Usually, in pediatric cases, the location is intracranial, while in adult it is spinal, and this is a very important point. Pediatric cases is intracranial, while adult is spinal. The common location of intracranial ependymoma is the fourth ventricle. Common location of intracranial ependymoma is the fourth ventricle, i.e. in pediatric cases, because in pediatric cases the location is intracranial. Anaplastic astrocytoma, AA, WHO grade 3 astrocytoma, and its more aggressive counterpart, glioblastoma multiform, GBM, WHO grade 4 astrocytoma, are the most common intrinsic brain tumor in adults and are almost universally fatal. Patients with GBM mean age is 55 years are generally older than patients with AA, mean age 45 years, with less than 10% of cases occurring in children. GBM arises most often in the temporal lobe, 32%, and the frontal lobe, 31%, whereas AA are frequently found in the frontal lobes, 40%. Meningioma are the most common type of tumors that originate in the central nervous system. These tumors are often slow growing, as many as 90% are benign, not cancerous. Some meningiomas are classified as atypical. These are not considered either benign or malignant cancers, but they may become malignant. A small number of meningiomas are cancerous. They tend to grow quickly. They also can spread to other parts of the brain and beyond, often to the lungs. Cancerous. Question number 4. A 79-year-old woman is brought to the physician's office by her daughter. The daughter explains that she is concerned that her mother doesn't seem right. As a part of evaluation, the physician conducts mental status examination. Which of the following would be a part of this examination? A. Ask her to walk hill to 2. B. Ask the date and her home address. C. Tap her patellar and biceps tendons. D. Touch both hands with a sharp pen. E. Touch both patellae with a tuning fork. Answer and explanations. The correct answer is B, i.e. ask the date and her home address. The mental status examination is an absolutely necessary part of all neurological examination, especially in the elderly. Again, the mental status examination is an absolutely necessary part of all neurological examination, especially in elderly. It includes questions related to 1. Orientation, which is time, place, and person. i.e. no, it is oriented to time, place, and person. 2. Registration. The physician names several objects and the patient repeats the same objects in the same sequence. This is a registration. 3. Language. The patient is asked to identify common objects or follow a series of directions. 4. Attention and calculation. Spell a word backwards, add a set of numbers. 5. Recall, repeating something done earlier in the examinations. These examinations, which is, again, orientation, registration, language, attention, and calculation, then recall. This examination provides a broad range of data on the general mental state of the patient. Asking her to walk hill to 2 is the test of cerebellar function. Walking on hills is the most sensitive way to test for foot dorsiflexion weakness, while walking in twos is the best way to test early foot plantar flexion weakness. Abnormalities in hill to 2 walking tandem gait may be due to ethanol intoxication, weakness, poor position sense, vertigo, and leg tremors. Tapping the patellar and biceps tendon is a part of motor examination, i.e. reflexes. The result of tapping may be hyporeflexia. Hyporeflexia is an absent or diminished response to tapping, or hyperreflexia, which refers to hyperactive or repeating clonic reflex. The two major sensory pathways are tested by touching the hand with a pen. Pen, thermal sense, or anterolateral system. Anterolateral system is the two major sensory pathway, which also called the spinothalamic tract, or anterolateral system, or ventrolateral system, is a sensory pathway from skin to thalamus. From the ventral posterolateral nucleus in the thalamus, sensory information is relayed upward to somatosensory cortex of the postcentral gyrus. Touching the patella with a tuning fork. Vibratory to examine vibratory sense, posterior column, medial meniscus system. Posterior column, medial meniscus system. The posterior column, medial meniscus pathway or system stands for PCML, is a sensory pathway of the central nervous system that conveys sensation of fine touch, vibration, two-point discrimination, and proprioception, i.e. position from skin and joints. It transmits information from the body to the primary somatosensory cortex in the postcentral gyrus of the parietal lobe of the brain. Question number 5. The 45-year-old man is undergoing a neurological evaluation for a movement disorder. A movement disorder. Don't forget, MRI reveals a diminution in the size of the head of the caudate nucleus. Head of caudate nucleus. Don't forget this point too. The man has two sons who are married but have no children. Which of the following would be an especially important part of overall examination and evaluation? A. Allergies. B. Family history. C. Medications. D. Social history. E. Surgical history. Answer and explanations. The correct answer is B, i.e. family history. A reduction in the size of the head of the caudate nucleus is characteristic of an individual with Huntington's disease or Huntington's chorea. Huntington's disease, HD, or Huntington's chorea, is an inherited neurodegenerative disease with prominent motor deficits, dementia, and eventual death from disease. The disease is not treatable or curable, but the best evidence for treatment of the movement problem is with tetrabenazine. Tetrabenazine. Symptoms usually begin between 30 and 50 years of age, but can start at any age. The disease may develop earlier in life in each successive generation. The disease may develop earlier in life in each successive generation, and this is a very important point in genetics. About 8% of cases start before the age of 20 years. About 8% of cases start before the age of 20 years and typically present with symptoms more similar to Parkinson's disease. Parkinson's disease. HD is typically inherited from a person's parent, although up to 10% of cases are due to a new mutation. The disease is caused by an autosomal dominant mutation. Autosomal, i.e., there is no difference between male and female presentation. Dominant, i.e., there is no carrier cases. Again, the disease is caused by an autosomal dominant mutation in either of an individual's two copies of genes called Huntington genes. Since this is a disorder that is inherited, the most important part of overall evaluation is to do detailed investigation of the family history. Again, detailed investigation of family history. Such information may not be freely offered. Diagnosis is by genetic testing, which can be carried out at any time, regardless of whether or not symptoms are present. But this point especially raises several ethical debates. In this man's case, he has two sons of childbearing age, and it would be an option to do genetic testing, although ethical debates, to see if they carry evidence of trinucleotide repeat on chromosome number 4. Expansion of trinucleotide CAG, cytosine, adenine, guanine, triplet repeats in the gene coding for Huntington protein result in an abnormal protein, which gradually damages cells in the brain through mechanisms that are not fully understood. Allergies are not relevant. This is not curable disease, i.e. Huntington's disease or HD, so medications may shed a little light. Surgical history would also provide a little insight. Social history may provide confirmatory data based on the interaction within his community. Question number 6. A 15-year-old boy is brought to the emergency department from the site of an accident. The history of the current event reveals that the boy was intoxicated, i.e. drunk, and hanging out the car windows when he ran into a stop sign, serving his arm just below the shoulder. Which of the following most likely specifies the reaction of lower motor neurons to the cervical spinal cord in this case? A. Axonotmesis. B. Chromatolysis. C. Neuropraxia. D. Neurotmesis. E. Neuroma. Answer and explanation. The correct answer is B. Chromatolysis. The lower motor neuron whose peripheral process were served in this case undergo chromatolysis. The cell body swells. The nasal substance is dispersed to the periphery of the cell body. The nasal substance is dispersed to the periphery of the cell body, and the nucleus assumes an eccentric location within the swollen soma. Chromatolysis is a process which is now called apoptosis. Chromatolysis, however, is still used as a term to distinguish the particular apoptotic process in the neuronal cells where nasal substance disintegrates. This image illustrates the difference between normal chromatolytic and regeneration. This is a normal neuron, this is a chromatolytic neuron, and this is regeneration stage of the same neuron. Depending on the number of the factors, the degree of the trauma, clean cut versus ragged tear, distance from the cell body, chromatolytic cells may eventually recover or may continue to generate until cell death. Axonotmesis is an injury to peripheral nerve of one of the extremities of the body. The axon and their myelin sheaths are damaged in this kind of injury, but the endoneurium, perineurium, and epineurium remain intact. Again, endoneurium, perineurium, and epineurium remain intact. These injured axons may generate, but are also likely to generate with time. This image illustrates epineurium. This epineurium, the most outer layer, perineurium, the second, endoneurium, the most innermost, the innermost. Axon, it is inside, as basal lamella. Neuropraxia is a mild type of lesion that doesn't significantly damage the axon or its myelin sheath and doesn't result in degeneration. Neuropraxia. For example, temporary compression of a peripheral nerve with numbness and tingling of an extremities, but with rapid recovery. Again, it is an example of the neuropraxia, temporary compression of the peripheral nerve with numbness and tingling of an extremities. Neurotmesis, in Greek, tmesis signifies to cut. Neurotmesis is part of Seddon's classification scheme, used to classify nerve damage, i.e., Seddon's classification scheme used to classify nerve damage. Neurotmesis is the most serious nerve injury in the scheme. In this type of injury, both the nerve and the nerve sheaths are disrupted. While partial recovery may occur, complete recovery is impossible, completely impossible. Till now. Neuroma designates a tumor of neural origin. Neuroma designates a tumor of neuronal origin. The term is also used to refer to any swelling of nerve, even in the absence of the abnormal cell growth. Any swelling, neuroma, may be any swelling of the nerve. In particular, traumatic neuroma results from trauma to a nerve, often during a surgical procedure. Morton's neuroma is a benign neuroma of an intermetatarsal plantar nerve. Intermetatarsal plantar nerve, most commonly of the second and third intermetatarsal spaces of the foot. Neuromas can be painful and sometimes, as in case of the acoustic neuroma, which correctly called vestibular schwannoma, VS, because its acoustic neuroma is misnomenclature, can give rise to other symptoms like dizziness, headache, vertigo, loss of balance, ringing sensation or rotation sensation, and numbness. Depending on their location, they may have more specific term. Question number 7. transmitted by what are commonly called lightly myelinated and unmyelinated nerves that have slow conduction velocity. Lightly myelinated fiber are also called E sigma fiber, and unmyelinated fiber are called C fiber, both having axon of small diameters. Which of the following characterizes the later of this fiber type? A. Axon lying free in the interstitial space fluid. B. Axon lying on the surface of the Schwann cells in the interstitial space. C. Axon lying within groove on the Schwann cells. D. Axon with only single layer of formed myelin from Schwann cells. Axon with fewer than 3 layers of formed myelin from Schwann cells. Answer and explanation. The correct answer is C. Axon lying within groove on Schwann cells. Recall that the conduction of an action potential along an axon depends on insulation of some type, separation of the axon from interstitial fluid. That provides for exposed segment of axon at either end of the insulated segment, which has sodium channels that are necessary for saltatory conduction. Provide for I serve two exposed segment of axon at either end of insulated segment, which has sodium channels that are necessary for saltatory conduction. Axons that lie within groove on the Schwann cells are surrounded by cytoplasm of the Schwann cells. Although there is no myelin, the Schwann cell serves as insulation function and provides a short internodal distance. Slowly conducting fiber have small diameter axons, short internodal distance, and little lightly myelinated or no unmyelinated myelin covering. Slow conducting fiber is the C fiber. Axon lying free in the interstitial space or on the Schwann cells within the interstitial space have no structural mechanism for saltatory conduction. Axon with a myelin coat of any thickness are myelinated. Unmyelinated referred to no myelin. There are two types of Schwann cells, myelinating and non-myelinating. Schwann cells are involved in many important aspects of the peripheral nerve biology, like as the conduction of the nervous impulses along axons, nerve development and regeneration, trophic support for neurons, production of the nerve extracellular matrix, modulation of the neuromuscular synaptic activity, and presentation of the antigen to T lymphocytes, immune function. Charcot-Marie-Tooth disease, CMT. This disease is the most commonly inherited neurological disorder. Charcot-Marie-Tooth disease, don't forget. Guillain-Barré syndrome, GBS. Acute inflammatory demyelinating polyradiculopathy type. Don't forget it's acute inflammatory demyelinating, acute. Schwannomatosis and chronic inflammatory demyelinating polyradiculopathy. This is chronic inflammatory demyelinating radiculopathy, and Guillain-Barré syndrome is acute inflammatory demyelinating polyradiculopathy type. And leprosy. All of this, i.e. Charcot-Marie-Tooth disease, Guillain-Barré syndrome, schwannomatosis, and the chronic inflammatory demyelinating polyradiculopathy and leprosy are all neuropathies involving Schwann cells. Schwann cells are the peripheral nervous system's analogues of the central nervous system's oligodendrocytes. However, unlike oligodendrocytes, each myelinating Schwann cells provides insulation to only one axon. Only one axon. Question number 8. 68-year-old man is undergoing a neurological examination. The history reveals that this man has not experienced any particular neurological event. But his daughter thinks that his personality is changing. During the examination, the physician asks the man to remember the phrase, "no monkey jumping on the bed." The physician proceeds with the exam and about 3 to 4 minutes later, asks the man to repeat the phrase back to him. This exercise is most likely testing which of the following: anterograde amnesia, recent memory, remote memory, retrograde amnesia, immediate recall. Answer and explanations. The correct answer is B, recent memory. Recent memory is a process of turning newly learning material into long-term memory. It is the recall of an event or information that happened just a few minutes ago, but with anticipation that may be available in memory in the future. Recent memory, which also called short-term memory or primary or active memory, is the capacity for holding, but not manipulating, a small amount of information in mind in an active, readily available state for a short period of time. For example, short-term memory can be used to remember a phone number that has just been recited. Short-term memory should be distinguished from working memory, which refers to structures and processes used for temporarily storing and manipulating information. Immediate recall is when a physician asks a patient to immediately repeat with no intervening interval a series of number or words. Remote memory, long-term memory is the ability of the patient to recall events that may be months or years old. Long-term memory is the aspect of memory in which knowledge is stored permanently to be activated when cued. It is theoretically unlimited in capacity. There are two main types of amnesia: anterograde amnesia and retrograde amnesia. Anterograde amnesia, where the ability to memorize new things is impaired or lost because data doesn't transfer successfully from conscious short-term memory into permanent long-term memory. And retrograde amnesia, where a person's pre-existing memories are lost to conscious recollection beyond an ordinary degree of forgetfulness, even though they may be able to memorize new things that occur after the onset of amnesia. Anterograde amnesia is the more common of the two. Sometimes both these types of amnesia may occur together, sometimes called total or global amnesia, i.e. anterograde and retrograde amnesia with each other. Another type of amnesia is post-traumatic amnesia, which is a state of confusion and memory loss that occur after a traumatic brain injury. Anterograde referring to an impaired memory immediately after the disorder, but retrograde referring to deficits immediately before disorder. Anterograde and retrograde amnesia are most frequently applied to memory deficits that follow the traumatic event or stroke. Amnesia, which occur due to psychological factor, is usually referred to as psychogenic amnesia or amnesia. In psychiatry, verb confabulate is disturbance of memory, defined as the production of fabricated, distorted, or misinterpreted memories about oneself or the world without the conscious intention to deceive. And this is a very important point: without the conscious intention to deceive. Many kinds of amnesia are associated with damage to hippocampus and related area of the brain, which are used in the encoding, storage, and retrieval of memories, which is the three stages of memory: encoding, then storage, then retrieval. Retrieval is the recall. Question number 9. The 79-year-old woman is brought to the emergency department by her daughter. The history of the current event provided by the daughter reveals that the woman complained of the sudden headache and after lying down for a period of time seemed very confused. The examination reveals an otherwise healthy woman who can see but unable to recognize what she sees. This is probably contributing to her apparent confusion. This woman is most likely suffering which of the following: agisia, agnosia, akinesia, apnea, apraxia? Answer and explanations. The correct answer is B, agnosia, i.e. visual agnosia. Visual agnosia is an inability to recognize objects or persons. A patient just cannot figure out what the object or who the person is. And this is the main problem. The patient may have visual agnosia, auditory agnosia, tactile agnosia, and so on. So, in comprehensive view, agnosia is a general term that indicates difficulty recognizing or understanding a variety of sensory inputs. Often, there is a loss of ability to recognize object, person, sounds, shape, or smells, while the specific sense is not defective, nor is there any significant memory loss. And this is more important condition. The specific sense is not defective. There is no disease in eye or ear or skin. There is no memory loss. It is usually associated with brain injury or neurological illness, particularly after damage to occipito-temporal border, which is part of the ventral stream. It is very common idiom nowadays. Agnosia only affects a single modality such as a vision or hearing. More recently, top-down interruption is considered to cause disturbance of handling perceptual information. This is more recently. A top-down interruption. Don't forget this, and don't forget ventral stream. Agisia is the loss of the taste functions of the tongue, particularly the inability to detect sweetness, sourness, bitterness, saltiness, and umami. Umami means pleasant, savory taste. It is sometimes confused with anosmia, a loss of the sense of smell. May be particular testant or too old testant. It may be particular testant or too old testant and may be an inherited disorder resultant to disorder of the taste bud or rarely CNS disorder, but mainly inherited disorder. Akinesia is a term for a loss of ability to move the muscle voluntarily. It is most often described as symptoms of the Parkinson's disease, PD. It can appear as symptoms of other conditions such as a disease or lesion on the basal nuclei. The patient has great difficulty initiating voluntary movement. One of the most common signs of akinesia is freezing. Apnea is inability to breathe. Voluntary doing apnea is called holding one's breath. Apraxia is basically an inability to execute purposeful or useful movement. So it is motor disorder caused by damage to brain, specifically the posterior parietal cortex of the brain, in which the individual has difficulty with motor planning to perform tasks or movement when asked, provided that the request or command is understood and he or she is willing to perform the ask. The patient understands what is to be done, has the muscle strength, has normal sensory function, but has difficulties actually performing the movement. The problem only in performing the movement, which mainly in posterior parietal cortex. Question number 10. Which of the following cells are essentially the immune cells of the central nervous system and those that react most vociferously to inflammation? A. Fibrous astrocytes. B. Oligodendroglיה. C. Protoplasmic astrocyte. D. Microglia. E. Schwann cell. Answer and explanations. The correct answer is D. Microglia. Microglia has hematopoietic origin and account for 10 to 50% of all cells found within the brain. Microglia are key cells in overall brain maintenance. Brain maintenance is the responsibility of microglia. They are constantly scavenging the CNS for plaques, damaged or unnecessary neurons and synapses and infectious agents. Since these processes must be efficient to prevent potentially fatal damage, microglia are extremely sensitive to even a small pathological change in CNS. This sensitivity is achieved in part by presence of unique potassium channels that respond to even small channels in extracellular potassium. These glial cells are found in all parts of CNS, are small in their resting state, but become large and engage in phagocytic activity when stimulated by inflammation or CNS damage. In the case where infectious agents are directly introduced to the brain or cross the blood-brain barrier, and this is not usual because blood-brain barrier is highly effective and highly protective barrier, microglial cells must react quickly to decrease inflammation and destroy the infectious agent before they damage sensitive neuronal tissues. Due to an availability of the antibodies from the rest of the body, because few antibodies are small enough to cross the blood-brain barrier, but mainly IgG maybe can transfer blood-brain barrier because it has a small molecular weight. Microglia may be able to recognize foreign bodies, swallow them, and act as antigen-presenting cell activating T cells. Microglia act as antigen-presenting cells activating T cells. Active microglia activating T cells, no B cells, because there is no antibodies. Active microglial cells are frequently described as lipid-containing cells. This is due to the fact that they ingest myelin fragments, microglial cells in their active phagocytic state, also called Debtor cells. Microglial syndrome is relatively new biological concept that appear to be playing a large role in neurodevelopment and neurogeneration. The syndrome refers to the unique grouping of protein transcripts of RNA used for sensing ligands and microbes. Astrocytes or astroglia have a myriad functions, versatile character, really, including biochemical support of endothelial cells that form the blood-brain barrier, provision of nutrients to the nervous tissue, maintenance of extracellular ion balance, and has a role in the repair and scarring process of the brain and spinal cord following traumatic injuries, secretion of cytokines and growth factor, and the metabolism of neurotransmitter substance, particularly glutamate. There is correlation between astrocyte hypertrophy in the dorsal horn of spinal cord, and the hypersensitivity to pain after peripheral nerve injury, typically considered an indicator of glial activation after injury. So, astrocyte has relation to chronic pain. There is a lot of types of astrocytes. Protoplasmic astrocytes found in gray matter and have many branching processes whose end feet envelop synapses. Some protoplasmic astrocytes are generated by multipotent subventricular zone progenitor cells. Some protoplasmic astrocytes are generated by multipotent subventricular zone progenitor cells, radial glial cells. Fibrous astrocytes, also called fibrillary, found in white matter and have long, thin, and branched process whose end feet envelop nodes of Ramphia, peripheral nervous system. Some fibrous astrocytes are generated by radial glial cells. Some fibrous astrocytes are generated by radial glial cells. Radial glial cells are bipolar shaped cells that span the width of the cortex in the developing vertebrate central nervous system and serve as primary progenitor cells capable of generating neurons, astrocytes, and oligodendrocytes, all types of nervous system cells. Neurons, astrocytes, and oligodendrocytes. Gomery positive astrocytes, these are subset of protoplasmic astrocytes. Oligodendroglial cells are myelin-formating cells in CNS. Schwann cells do the same function in the PNS, i.e. peripheral nervous system. So the various type is protoplasmic astrocytes, fibrous astrocytes, and Gomery positive disorder astrocytes is subtypes of the protoplasmic astrocytes.